So you're starting to have issues sitting at your desk, and there's always that pain in the middle of your spine, that middle of your shoulder blade. You wonder how you can get the answers and get this right solution. So stay tuned and we'll get right back to you with the right answers for this very important question. Hi everyone, this is Dr. Lin of Rehab and Revive Physical Therapy. So excited for you to join us on this episode. Hopefully you got a chance to look at our lift-off exercise of the lower back. Guess what? I've been playing around with this and I believe there's a great lift-off exercise for your upper mid-spine. A lot of you don't know, the multifidi also runs all the way down to the back of your skull. And that's also important to stabilize. A lot of the popping, all the stuff, you know, if you're going chiropractor all the time, sometimes it just gets loose. And you really need to cinch that up. So we talked about in a previous episode, we'll link that below, about this ability to really have these pillars get a little stronger. So, you know, in our next episode, or this episode with Tim, we're gonna talk about how to get that moving. So stay tuned and we're gonna get right back to you with the answers to help solve this big problem that, you know, kind of plagues us all. So here we are. We had a great episode with the lift off of the lower back, but there's actually multifidi muscles that run all the way up, all the way behind your skull. So how do we get these ones? And this one I definitely made up after playing with this. I realized it's such necessary. These are the people with all that mid-back pain we want to take care of. So it's the same concept, just like the lift off in the leg. If you guys didn't watch that episode, what we're trying to do is we're trying to go straight up towards the ceiling. So, and what we really want to look for is there sway, is there rotation? You want to avoid those, you want to be stable. So why don't we take a look at the right side on Tim. Go ahead. And you can see right now, if you take a little shot, he's seeping a little higher now. So what we want to do is play a percentage game. Right now his elbow is 100%. You want to lift it 5%, 15%, you know, 20%, every 5% increase. Now you see him swaying right here, right? So if I try to keep him here, all right, go ahead and try that again. That's a lot tougher. So that's his resistance. Right now he's shaking. So he's about what, 15%? That's all he can do. Why don't we take a look at the other side? So let's see what happens here. So on this side, he's doing pretty good. He's shaking quite a bit here. And this is great to protect that spine, like I said, this exercise. Now he's starting to get his elbow off, so let's see if he can get his forearm off. And that's pretty good, but it's still not perfect. So he should probably stay around there. Our goal eventually, let's use this arm though, is to actually reach forward like a dog pointer, you know, like one of those pointing dog. Yep, good. Let's go here and hold it. And so, like I said, a lot of people do this opposite leg, opposite arm thing at the gym incorrectly. They're usually rotating too much. So let's show everybody what it would look like. So it'd be like this, and then they'll shift a lot or they'll rotate. But this is great for protecting your neck and all those people that are always at the desk. And this guy's sweating up a storm right now. So you can see that this is the key to helping him out, and we really can work on this. So this is a great exercise, like I said, to protect the spine. A lot of things, everyone's trying to do different things to stabilize, but I think this is a very important group of muscles to get after. So there you have it. Tim did a great job. You see his right side was a little bit floppy. He pretty much can only lift off about 10, 15, 20%. So he has some work to do to get to 100% before you get your elbow. You know, some pointers to think about is, you know, you start with full weight on the surface, then you slowly just de-weight. That's the best way to think about it. I always want to instruct my clientele that you want to de-weight 5% at a time. When you get to 100% and you got that down, that's when you can start holding it there in place until the shakiness stops, or you can start reaching until you hit the limit of when the shakiness starts or begins again. So once again, we're trying to re-educate that multifidi. I don't think there's any exercise out there in the market that is teaching this stuff, so I'm just giving it away to all of you guys. Make sure you check with your healthcare professional and make sure it's the right exercise for you. But I think you know, this stuff really works out here at Rehab and Revive. So hopefully you like what we're doing. If you think this is a great exercise, keep sharing with other people. Leave a comment below. Subscribe to what we're doing. We're trying to give information, just really help the community, the world. Some great comments from people from Dubai, so I really appreciate your commenting and your feedback and seeing that you guys are improving. And so I'm Dr. Lynn of Rehab and Revive Physical Therapy out here in Tustin, California. Remember, we can and we will get better together.